Quick question before we get started with the show. Do you order lab tests from companies like Dutch, DSL, Genova, or Vibrant America? Hi, I'm Dr. Carrie Jones, Head of Medical Education at Rupa Health, the absolute best place to order, manage, track, and get results from 30-plus lab companies all in one place. Practitioners using Rupa Health are saving well over 15 hours of admin time each week for their lab ordering process. With just a few clicks, you can order from 30-plus lab companies, that's over 3,000 tests, for free in one single portal. That means one invoice for all labs, paid online upfront. Plus, patients get practitioner pricing and receive full patient support through easier personalized collection instructions, automated follow-ups, super bills, answers to testing questions, and so much more. Go to rupahealth.com to sign up for your free account today. Now, let's start the show.
Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Hi, welcome to Redefining Medicine. We're in Las Vegas celebrating Longevity Fest 2022. It's A4M's 30 years of medicine redefined. And we're right off the stage, and we're talking to the leaders and the most important people who have made A4M what it is. And today, now, I'm speaking to the most amazing of them all, Dr. Jim LaValle, who's the chairman, the ultimate leader of IPS that I'm honored to be a faculty member of.
Absolutely.
And I cannot believe we got you here.
Well, and when you're the co-chair for A4M at an event like this, yeah, it's been a little bit of a run.
Amazing. Over 5,000 people.
I know.
Over 5,000 people are here. It's the most unbelievable event I've ever been part of.
Yeah.
And I'm so honored to be part of it.
The energy is so electric
it
and
is
positive,
amazing.
isn't it?
Amazing, yes.
I
And
know.
everybody's doing such a great job. And everybody's just like, we're high on like caring for each other and teaching each other and learning. It's amazing.
I could not agree more.
It's wonderful. So let's talk about two things.
Okay.
Your new book that you
go.
did together with two of my other favorite people there.
Yeah.
Gordon Crozier and Andy Heyman.
Yeah.
And Cleaver. Anyway, and we'll talk about that in a second. But talk to us about intermittent fasting and what
Yeah. So, I mean, I think first of all, I think some of intermittent fasting is interesting, right? Because for the longest amount of time, if you're out of my generation, which, I'm in my 60s, and
you're a child.
I am a child. Okay, I'll take that. I'll take that. But, we grew up eating at 7 in the morning, having lunch at noon, having dinner at 5. And if you were a good little Italian boy anyway, you got a little snack at 7. We were doing 12-12 all the time. Mm-hmm. And of course, as food gets plentiful and we can stop at every gas station to get something to eat, people expand their palate all day long. And so it became important, of course, to look at the literature as it relates to, well, why is intermittent fasting important? Well, the first biggest reason is intermittent fasting is important in using, for example, the fasting mimic diet that was developed from L-Nutra with, Prolon, is it was the first time that you could actually do a program that was university researched that mimicked the effects of actually fasting. Now, why is that so important? Because so many people aren't eating, and taking a break from their eating, right? So they don't ever rest from their eating. That during that 5-day period of doing fasting mimic diet, you mimic the effects of fasting. The evidence is very clear. You trigger autophagy, you help to kind of remodel their metabolism and get them to be more efficient. Their blood sugars improve, their lipids improve, their inflammatory markers. And I think it also, when you look at the qualitative data that came out of it, what was striking to me is that people came out of that 5 days thinking more responsibly about the way they were eating, their portion size, and about trying to stay on managing their weight. Now, of course, anything worth doing is worth overdoing. And so there's people.
We're Americans.
Exactly. I mean, I'm ready to go. And so, you get people that are doing 18-6 fasting 7 days a week, which I actually find when people come in, it's a little bit harder on their chemistry than what they think. And so I think it's great that you have an organized plan like Fasting Mimic Diet that's got so much research behind it. I mean, NIH grants, leading universities, that gives you a clear pattern to say, hey, for these 5 days, we want you to eat this way, get these metabolic benefits defined, improve your baseline eating habits, and then maybe, the way they did it in the research was, of course, in the next 30 days, you do it one more time. And then for a third time, you do it one more time. So in the first 90 days, you do that 5-day fasting mimic diet, and they have tremendous effect. And now if you look at the benefits in metabolic syndrome and people that are struggling with blood sugar, they want you to do it that 4th month. And after that, you do it a couple times a year, and you're gaining some very significant, kind of longitudinal benefit with your health. So, I mean, I've recommended it for a lot of people, and was one of the early. I've done it 5 times.
Yeah.
Sure, I've done it, and of course, I was one of the early adopters and brought it to A4M and really exploded kind of this concept and all the research that went with it to A4M. And I mean, a good 1,000 docs are using that platform now. So I think it's great because once again, anything we can do to help people to eat a little less and lose a little bit of weight, that's good medicine.
Absolutely, which gives me the opening to talk about peptides, right?
Right.
So we can talk about semaglutide for a second.
Absolutely.
And about how semaglutide just burst in. We've been doing it for about 5 years, but now Ozempic came and changed the world, and we see it in every newspaper, magazine, everywhere you turn, on media. We have like the social media. Everybody's on Ozempic.
Right.
Now, the thing is that actually helps with what you said, which is that it is kind of fasting mimicking because it is changing their relationship with food.
I think it is one of the most important things on the peptide community, obviously since insulin, right? We can't underestimate the
let's not forget that peptide.
1920s, they developed insulin, which is a peptide, which is pretty important too. But what I like about the GLP-1 agonists and of course the mixed agonists now, like tirzepatide, both of them is that we got half of our population's either diabetic, 13%, 37% are insulin resistant. We've got 1 in 3 Americans from age 18 on has heart disease, and 50% of those over 55. And so a lot of that's centered around, inappropriate, too many carbs, glucose numbers are up. The number one thing that plaques your arteries is postprandial glucose and insulin issues. And so when you have something like semaglutide that helps to calm down a person's appetite, help to create efficiency in the way they're burning their fuel, help them to get weight off, the biggest challenge with it, I find, is just, are we doing enough to teach people that it's a lifestyle that they have to follow afterwards? Because we don't want it to turn into kind of what was popular in vogue 10 years ago or so, was the HCG diet, where people were up, down,
Yeah,
up,
but that
down.
didn't really work. It wasn't real working.
Yeah, not
because
like
it
this
was like
does.
an 800-calorie diet, so it was a different story. I think that I was speaking to a nutritionist who spoke today at the conference, and she didn't even hear of Ozempic, which is really interesting. And I think that it's, she was talking about, no more fad diets, and I'm glad to hear that they're thinking that way, which is really great.
That's right.
But I think that it's kind of, I feel, and we're peptide people, so I feel that with semaglutide, you're giving them the opportunity to change their life forever, because you can always go back on it if you gain 5 pounds, by all means.
Right.
You don't have to stay on it forever,
That's
which
right.
people always say, oh, am I going to stay on it forever? No. You
Exactly.
just go off when you don't want it. And it changes the way they look at the food.
I think we've done it with lots of folks, and I think it's amazing that it starts to quell their appetite. It does change their desire, which is huge.
Huge.
And then, for me, diet's always been talking about a lifestyle of eating.
Totally.
So if you go to, say you're in Sardinia, you're going into one of the, the
you're
big,
not going to change.
Right? It's like they have a lifestyle of eating.
Of course.
And a lifestyle of eating that promotes health. So what I like is when we combine the power of a semaglutide with education and a lifestyle of, hey, how are you going to really maintain how you're going to feel? Bring the weight down, keep yourself dialed in and optimized, and then allow yourself to kind of venture into the other peptides that can really help, whether it's a growth hormone secretagogue to help with that. I'm 55 or I'm 65 and want to kind of reorient my night sleeping pattern and get my growth hormone working. Or if people that are mitochondrial challenged that have real insulin resistance and they're tired, a peptide like MOT-SC, which is a mitochondrial-derived peptide, which is going to help that. I mean, look, these are really interesting things that can help move people in a way that creates a permanence to the way they feel. Right. And I think that's, for me, that's where I've always been is, how can I really help empower somebody to actually take that bold move to embrace being well?
And that it's doable.
Absolutely doable.
And it's doable, and we see it every day. And I think that, which brings me to the peptide handbook.
Right.
So tell me about it.
Yeah, so I started on this book about 2 years ago, actually. And so one of my senior staff writers, Ernie Hawkins, master's degree in pharmacy, he and I have been working together on whether we're writing on botanicals or other pharmacologic agents or on peptides. We really just sat down and said, all right, we're going to start writing about these so we can start to inform healthcare providers about it. And then obviously we had, Joe and Gordon and Andy, so Dr. Heyman, Dr. Crozier, Dr. Cleaver, who were helped as reviewers, added in protocol. Dr. Heyman wrote the foreword. And I think it's really to try to give a little bit of guidance based on the literature. And there's only about 750 references in there from Tier 1 primary referee. Yeah, journals. I try to
just in case somebody wants to know if there's science behind it.
Yeah, I just took it a little bit easy. Is there a couple references or not, right? So like most of the stuff that I've written, it's very heavily referenced. And I think, look, it's a start. The way I actually developed that book is as we get new information, we simply will update that information up online, and the new books that get printed will automatically have the new information. So it's an evergreen handbook for people.
Beautiful. Well, people need that. And as I'm teaching in your courses,
Absolutely.
in the peptide certification, and I invite all of you to take the peptide certification courses. There's no other place you can get them. There's no one else who really knows peptides better than Dr. LaValle and his team.
Oh, I would say my team knows it better than me. I've got world-class experts.
Amazing.
Yourself.
No, I'm not.
Everybody everybody loves when you're teaching. I get the reviews. You got to remember that. So, so you get wonderful reviews, I'll tell you. And just, we've got all these specialists, whether it's a raumatology or internal medicine or it's, OB-GYNs. Look at Dr. Duque and her skincare, bringing all these, this revolutionary new way to do skincare where you're actually just feeding your tissues what they need.
It's amazing.
It's
amazing.
I think
it's beyond
exciting.
Cutting edge. I think it's really amazing, and I really encourage you, and I'm not just saying it because I'm faculty and because I love him, that's not, but it's the truth. And I think we need the handbook because I think people just go there and they listen to, they'll have the compounder help them, they'll read here and there. They don't get the information that you get in this book. And I think that this is really important. And I think the fact that you said it's an evergreen, and once you belong in this family, then you get constantly updated on what's going on. And peptides is such a dynamic field, and it's moving so fast, and it's wonderful. And when they started with the Ozempic, I was like, we've been doing this for 5 years. What are you talking about?
Come on. Exactly.
It's like-
and the other piece is look, if people are really interested, joining the International Peptide Society.
Right. Please
all
don't
of the
forget
monographs that we're writing, so they're fully referenced. You can click and get the full text article on everything that is cited. I don't know what anybody else is doing it. It's really amazing though, right? Because we're trying to provide the information so clinicians can really do their best, be their best, understand that this is just another valuable tool in their toolkit.
Exactly.
Whether it's, hey, how am I going to make the hormones that I'm giving even be better? Where's our nutrition at? Can I minimize polypharmacy by using some peptides?
Of course.
All of those things are important because in the end, at least for me, I always believe people deserve vitality at every stage in life. So if I can do things, right? I mean, so
totally.
Peptides to me is another one of those valuable tools, and I think probably one of the biggest that I've seen, this revolution.
Because there's no side effects if you know what you're doing.
That's exactly
And
right.
you can put on so many of them, you can layer them, you could do so many things with them that there is no reason to not try them or to be afraid of them
Absolutely.
There's nothing that I could think of that better than peptides to complete the picture.
Yeah, it's made a huge impact in the last 8 years for
Amazing.
our practice, how we teach, what we do.
I can't believe it's 8 years. Amazing.
I know.
Amazing. Well, thank you so much for actually taking the time to do this because we've been trying to do this for 6 months. But we did it. So
no, we made it. No, it was my pleasure. I'm glad we got it.
Thank you.
Great.
Thank you.
Sure.